electronically. After tonight's session, there'll be follow-up meetings of the Board of Health. Those will probably be exclusively electronic, so there'll be no in-person meetings. If that's possible, if it's not possible, then obviously we'll do what we need to do. At the end of the meeting, we have a group of items that I'd like to discuss with my fellow board members and craft a town's response. But at the end of the meeting, we'll open it up for comments or questions from members of the public. I can't anticipate exactly when that'll be, but we'll make sure we do it before the meeting ends. So beginning with the items that I'd like to cover tonight, one of the first is that, in fact, as I just mentioned, the public buildings here need to be closed to members of the public to try to eliminate the spread of the disease. I'm sure it's become obvious to everyone that's here. We just had a member join us. That the way COVID-19 is spread is by human-to-human transmission. So it's very straightforward. If you can only get it from someone that has it, and we need to try to keep people separated so that it's not transmitted. Interesting. So that's the purpose of the rather extraordinary measures we're taking. Hopefully it will be temporary. So as I mentioned, the public buildings have by necessity been closed to members of the public. That requires as I understand it, a motion from the Board of Health confirmed by the Selectmen or the opposite. So in that case, I'd like to suggest that we confirm the Selectmen's decision to close the public buildings, and because of the current health emergency, that would, I'll open it for members of the board, both present and remote, for discussion, but if there's no discussion, I'd entertain a motion.
Peter Barry of the Board of Selectmen. Just one point, the Selectmen have not yet voted to close public buildings. That was a decision the town manager made. I do think it's important for, particularly in a crisis like this, for these decisions to be authorized or sanctioned by the legally authorized authorities, which, as you mentioned, are the Board of Health and the Board of Selectmen. So I think it's appropriate for the Board of Health tonight to take a motion to ratify those actions and maybe declare a state of emergency under the statute and you know, authorize those extraordinary measures to be taken. The Board of Selectmen is meeting tomorrow night, so we can ratify that tomorrow night and maybe declare our own state of emergency and allow these legally authorize these extraordinary measures.
Okay, very good, thank you. So as I said, members of the board, are there any discussion?
I think it's a good idea, given everything that's been going on. We want to keep the public safe, keep employees safe, and you know, get a handle on what is going on, and as we all heard, you know, flatten the
curve.
Flatten the curve. So I would be in support.
Okay, is that a motion?
So moved.
May I ask members either present or remote, is there a second?
I can second it.
Very good. Rika seconds it, so we have a motion made and seconded to confirm or authorize closure of public buildings as part of the state of emergency. I'll ask both members present and remote, all those in favor, please say aye.
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 Aye. And do we have, well, hi, John?
I think a roll call vote would be helpful, just to, for remote participation. I think roll calls are helpful, if not necessary.
Fair enough. We actually have a majority vote at the moment, but it can't hurt. So I'll start. Joanne, you're an aye?
Yes, I'm an aye.
Rika? Aye.
Yes, I'm an aye.
Mr. Conaby, if you're on the phone, could you please let us know your vote?
Yes.
Dr. Taylor?
Aye.
Thank you. Dr. Taylor? I can see you, Dr. Taylor. Well, give us a thumbs up if you're in agreement. Okay. Mr. Cruz? Okay, well, I'm going to declare that the motion passes because we've got sufficient number of votes for the motion to pass. So motion passes. As you can see, we're still working out this procedure. Hopefully we'll get better as time goes on. Along those lines, one of the things for the folks that maybe are attending remotely, I'd just like to make a brief introduction to members of the board. We have a very strong board, I believe, to respond to this emergency. It's not desirable, of course, but at least we have strong people to help with the current emergency. With me tonight is Dr. Rika Singh. She's MD, PhD, professor of immunology and infectious diseases. Right on point for things we're dealing with. Next to me is Mrs. Joanne Becerra. She's currently working with the state of Massachusetts on environmentally beneficial practices, but has also worked previously with the Department of Public Health and the Department of Environmental Protection. Remotely is Dr. William Taylor, who was former director of emergency medicine at Atlanta General and the medical director for the Medicare Northeast. So also has great expertise. Also remote is Mr. Mike Cruz, who's a senior member of a team that's working on vaccines for respiratory viruses at a major pharmaceutical company locally. And Mr. Mark Conaby, who is a local business owner, works in infection control or remediation of hazardous wastes, and is also a practicing attorney. And then we have Dr. Tom Jacoby, who is an expert in hygienic practices and infection control. So we have very strong, oh, and then there's me. I'm a chemist and an electrical engineer, and I try to help coordinate the activities of this very strong and accomplished group of people we have. So just as a matter of introduction, I think at least we have a strong team. We also, with us tonight, have members of the Land Use Department, Health Division in Cheryl, and the Health Director. And we have Heather from the Nursing Service, and Heather from the Nursing Service. Heather York. No, I'm trying to remember. Organizationally, you're part of the Human Services organization? Okay, thank you. I'm sorry, I did remember your last name. Okay, so with that, some of the other business, and let me just ask, did you want to introduce the selectmen, or are you all set?
Yeah, I'm Joan Gardner, Chair.
You have to turn your mic on.
Joan Gardner, Chair of the Board of Selectmen.
Dean Trotter, Clerk of the Board of Selectmen.
David Martin. John Benson, Vice Chair of the Board of Selectmen.
And Peter Berry, Selectman.
All right, very good. Well, thank you. So for the other business that we have tonight, we've got continuously evolving guidance that's coming from both the state and the federal government about what's good practice. We have some businesses that we would like to discuss with members as to how we might approach. They don't have specific guidance. One example would be daycares, others would be after-school activities such as dance centers, theater companies, things like that. Also, after-school or other activities such as fitness facilities, gyms, things like that, what we want to recommend. We also have an issue with supermarkets, which will obviously be staying open, but they have practices such as buffets or salad bars or self-serve items that we might want to address or offer some suggestions. So given that, I guess it would make sense to me to just take those in sequential order. Probably one of the most pressing is daycare centers. Would open it to discussion, members of the board, either present or remote. Is there an opinion? Joanne?
I was just going to ask if we know the status of the existing daycare centers, whether any of them have voluntarily closed or...
Yes.
Sense?
Yeah, we definitely have had some voluntary closures, but I probably received about 10 to 12 calls today from other daycares or concerned parents, and all expressed questioning why they weren't closed.
Okay. Rick?
I think it would be good to close them so that the children are safe, but then again, some of the parents are still working and they want to send their kids for daycare. So in that circumstance, we should need to look at like the employees who are working at the daycare. If anyone has any even minor symptom, they should not be in the daycare because they'll be exposing the children and other employees. So in that case, I would say that if the parents need the daycare, then only it should be open. But if the parents are already complaining, then those daycares should be closed, because if most of the parents are home, but there are companies which are still open and the employees are required to go to the company. In those circumstances, if the parents don't have any place to leave the children, they certainly need daycare open, so.
Indeed. It's, unfortunately, there's going to be a lot of painful adjustments for all of us, I'm afraid. And there is no good answer, I know. Can I ask remotely if any of the remote members of the board, are there comments that you can share? Let me ask in particular, I'll start. Mr. Cruz, are you on the line? Mr. Conaby?
Can you hear me?
We can hear someone.
The audio is very garbled.
I'm sorry, you might be getting feedback. I'm going to mute my mic. Mark, if you can hear us, please go ahead. I'm going to turn my mic off, and maybe that'll help with the audio quality.
I'm having a hard time hearing along with Mike. I don't know if there's anything that can be done.
We're trying our best, Mark, but I don't think we're going to be able to improve much beyond where we are.
All right, thank you. I guess try to talk slowly and clearly, and turning off the mic, as Mike has suggested, may help.
Okay, so I will turn off my mic very shortly. The question would, did you have any thoughts on what the correct approach for daycare centers would be?
I didn't hear what some of the other folks had said, but I have serious concerns about this as a risk in transmission. It seems like the schools have led, and we've already had closures of the public and private schools with these age groups. And if we're trying to minimize risks for groups of less than 10, it does seem that it would be prudent to at least request that they close to minimize contacts and transmission. And if that's not happening, then we could reconsider whether it be appropriate to issue an order at a subsequent point.
Okay, thank you, Mark. Dr. Taylor or,
Thank you.
Or Mr. Cruz, do you have comments?
Can you hear me?
Yes, we can. I'm going to turn my mic off now, Dr. Taylor.
The governor's
Bill, this is Bill. We can't hear you. I don't know if you're saying anything or not, but we can't hear you.
Can you hear me now?
Yes, we can. Please go ahead.
the date, can you hear me?
Yes.
I just turned the telephone off.
Oh, thank you.
The daycare issue can be addressed through the CDC document on K through 12 and daycare. And that's the governor's current Sunday night recommendations. Daycare closures would put, I think at this point, a lot of pressure on parents. And two family households that must be going to work, it may be very difficult. The actual breakdown is if there is a case, then it's closed down for 2 days, environmental cleaning, and only children that are well are allowed to come back.
Okay, thank you. So you would recommend, if I can put words in your mouth, you would recommend keeping them open?
Could you hear anything I said?
Yes, I believe we heard everything you said.
Okay, excellent. I would like to make a general statement. I saw a brilliant article in the Globe on March 13th, written by all the infectious disease specialists at the Boston hospitals. The title of that article was "Don't Be Cavalier About Coronavirus." I think this makes clear that there are steps that we need to adhere to starting immediately. And I would like to make particularly the case definition is fever and cough and possibly shortness of breath. And that means that even if you don't know who exposed you and you have those symptoms, you need to self-isolate for 14 days. Now, I did want to also talk about testing. Without adequate testing, we can still use the clinical definition so that people would self-isolate if they have fever and cough. And I did also want to say the medical and hospital personnel are at highest risk of exposure in the pandemic. They already have people with cases who have to be isolated. They are all already preparing for long hours, up to 80 hours a week. So there is a plea for conserving medical resources. Calling your doctor, not visiting the office, not going to the emergency room without calling ahead, etc. So I just wanted to state that because there's a lot that can be done. And I think in this pandemic, there will be two sets of heroes. I think the medical and hospital staff, and I think those that took care to socially distance and self-isolate if they have fever and cough. If testing becomes more available, you can be tested, and if it's negative after you've been isolated, then you can come out of isolation. Otherwise, you need to go the full 14 days.
Okay.
Thank you.
Thank you, Dr. Bill. So we had two other members I don't believe we've heard from yet, Mr. Cruz and Dr. Jacoby. Are either of you available online? Okay, I'm going to take that as a no, because if you're online, I apologize, but we can't hear you. I'm going to offer a suggestion to the board and see if it's acceptable to the members. It sounds like, I recognize there's a hardship issue. Dr. Taylor has mentioned that there are guidance available from the CDC, but the guidance has recently been updated as as recently as this afternoon on some of the practices that we're to follow. So my suggestion is to ask for the department staff, Cheryl, sorry, to please contact the daycare facilities, ask them how they intend to implement the CDC's practices as well as the current guidance. If they have a strategy that allows them to keep, adequate separation, adequate infectious control, keep separation between the staff and the parents, and also have a practice for disinfection of the premises, then we would certainly want to consider that. But otherwise, it would be our recommendation that they need to close. So that's my proposal. I ask for comments from members of the board. Dr. Singh?
I think hopefully the government is going to lock down in a few days. And once that happens, then the daycares cannot be open, right, in any case. So then the parents will be at home to take care of their children. So hopefully the government will take care of it.
Ms. Becerra?
I agree with your approach because it is a tough choice because some parents, particularly those that are in the medical profession and are working with folks, do need daycare. But on the same token, obviously, you want to keep the social distancing. So if these centers are able to adhere to those guidelines, I'd be okay with them remaining open. I'm going to maybe go out on a limb and guess that parents who are concerned about it aren't sending their kids there anyway because, if somebody's home, working from home, or is told to stay home. But I think those that need it, let's try to keep them open if it's possible.
Very good. Thank you. Dr. Taylor or Mr. Conaby online, any comments?
Yes, I wouldn't. That risk of coronavirus infection.
I'm sorry, Bill, we can't.
Rarely
much better.
children even require hospitalization. So I think, I don't know if you've seen the document that I sent to Cheryl, but there's a school decision tree. And it says, even when there's minimal community transmission, you can still interrupt, close down a daycare center, environmentally clean it, and open to only those children who are well, with only workers who are well.
Okay, thank you. If you could forward that to Cheryl, that would be very helpful. You already have it, Cheryl? Oh, perfect. Oh, thank you. Thank you. We already have it, Dr. Taylor. Mr. Conaby, do you have comments?
Yes, I have concerns that we say that the children are well and the care workers are well, but the problem is that they could be infectious and transmitting while not exhibiting symptoms, and that's part of the reason for the social distancing. So the concern is that we may not be setting the right example or implementing the right strategy of containment and social distancing by allowing these centers open, because it does provide quite a pathway and a vector for some of the transmission through some of our other parts of our population. It is certainly essential to have daycare workers and child care for first responders, medical personnel, and others. But we don't really know what that impact is, and we do know that it could be a high risk. If we're closing the schools, which will also impact a lot of folks, and a lot of other operations, restaurants and things, it seems that this is fairly high-risk endeavor as well. So I have very serious concerns. One thing would be very interesting to know is, have the daycare centers in town already closed? And what has been the impact so far? And what is their population? It seems we don't really have any information about that. I would certainly like to know what the situation is currently and what their anticipated plans are. And we could certainly do that prior to the meeting on Thursday, but I do think it would be best if we did recommend that they be very cautious, minimize the risk. It would be best, since we're telling people not to engage in other activities, to request that they do close down to minimize this risk in the near future. Thank you.
Okay, thank you, Mr. Gonaby. I apologize. I think our communication link is not as robust as I wish it was, but the question put forward was an approach that if a daycare could demonstrate that they meet the requirements for social distancing or other recommendations from the CDC, and it's, you know, it would be up to them to show that they meet those requirements, but if they can, that could be acceptable to then remain open. Otherwise, our recommendation would be they close. And so the question was, are you in agreement with that approach, or do you wish to offer a different approach?
General concurrence.
What I think Sorry, I'm hearing a little bit of reverberation and feedback. I have concerns that approach has some inherent problems with the ability or the inability to provide information whether folks are actually healthy or whether they are not exhibiting symptoms and could be transmitting the virus or other infectious disease. So I'm not in complete concurrence with that policies. I guess my thought was first to find out whether voluntarily they've already done it prior to making that determination.
Okay, that's perfectly reasonable. And then after that, you proceed to the next step. Is that acceptable?
One step at a time, and we'll see what the CDC guidance and other state DPH requirements and recommendations are, because it seems to be a fairly fast and changing policy and requirements.
Okay, very good.
Mr. Chairman, can I make a comment?
Sorry, do we have Dr. Taylor?
Yes, I think it's important to recognize that 80% of all coronaviruses infections recover without hospitalization, without severity. The at-risk group is not daycare children, or for that matter, school children. The highest risk group are those over 60 years of age. The highest death rates occur in that group. And I think the message that needs to go out, people over 60 need to be very careful. They need to avoid crowds. If they can, they need to stay at home. They are at highest risk.
Okay, thank you. Mr. Martin.
Yes, I was wondering if you knew why the state hadn't already taken action for child care centers. And what I'm wondering is if it's important that child care centers remain open to care for children of healthcare workers. I know healthcare workers who have been advised to have 2 backup plans for their childcare because the hospitals and other medical centers that they work in may ask them at some point to work essentially double or even more time. So if, someone's not going to be working 80 hours a week with no childcare if they have young children, if they have junior high school age children, presumably they can leave them alone and have a relative check in on them or whatever, but not a 2-year-old probably. So I'm just wondering if we know why the state hasn't already taken this action and if we've considered everything.
Okay, thank you. I'll just tell you personally, I don't know why the state hasn't addressed it. I imagine I'm sure it's on their list of concerns. It just hasn't made it to the top yet is a guess, but that's just my guess. But if anyone has...
Yes, I would comment on that. On Sunday evening, there was a declaration from the governor, and he said the daycare centers were not included in the mandatory school closures for 3 weeks.
Okay, thank you, Dr. Bell. So this is not an agenda item that I believe requires a vote. This is to get a sense of the board. What I'm going to recommend to the board, and people can comment if they wish, is that we put this on the agenda for review for our Thursday meeting and ask, as sort of highlighted, for Cheryl to gather the information as the board has sort of laid out, determine what is currently being done, what their practice is and what their plans are. Our goal isn't to impose a solution. Our goal is to try to find the best solution that keeps everybody healthy, and protects the public health. And but at which point we can get some feedback on Thursday, and if we need to take action, we can do it at that time. Is that acceptable to members? I hear any objections? I'm going to say it seems to be. Dr. Bill, I can see your...
I think it is acceptable. However, I would caution, there are federal guidelines, there are state guidelines, and in Massachusetts, they could be 351 local health agency guidelines. So I think we need to be as consistent as possible. And I think Massachusetts has been the most restrictive of any state with the emergency that was described on Sunday evening by the governor.
Okay, very good. Well, thank you. Then I'm going to move on to the next thing that I believe we should talk about. It's related. It's other after-school activities, such as dance studios, theaters, typical after-school, like karate schools, typical after-school activities. And again, just to try to keep this discussion moving, I'm going to offer a suggestion and then ask for comments. My suggestion would be that they should roughly match the schools. If the schools are closed, then they should be closed. If the schools are open, then they should resume their activities. If it's considered deleterious for the school-age children to attend school, it's probably the same would apply for after-school activities. So that would be a recommendation. At this point, I ask if members of the board are in concurrence.
Just a question or qualification. If there are activities that are don't involve 25 people or more, if it's just using an example like the batting cages, where you're in there and you bring your own bat and the kid needs to blow off steam and hit some balls, whether that would be, and the facility would still adhere to CDC recommendations of sanitizing and keeping it clean, whether you want to qualify it with, keeping it to groups of a certain size, could be 25, could be 10, or whether one-on-one or, parent and child using a facility that meets certain standards, whether that would be appropriate.
So I'll amend what I said. I believe the current standard is groups of 10. And that, yes, you're absolutely right. If it's an individual activity, then, or very small group, then, yeah, that would certainly be acceptable.
But things like classes, swim lessons, karate, dance classes, I certainly agree.
Okay. Dr. Singh?
Yeah, I totally agree with you, because there's no point keeping those open if a big group is coming in, because in that case, they will be coming in close contact with each other, and especially if they are using the same instrument, then they are bound to get infected somehow. So I completely agree with your suggestion.
Okay, thank you. Dr. Taylor or Mr. Conaby?
Yeah, I concur.
As well, Bill, I just have about things like fitness centers and hair salons, because they wouldn't just be exclusively school-age children. There could be a lot of older adults and potentially high-risk folks over 60. So hopefully they'll take the proper precautions, but certainly keeping with those recommendations would be advised.
Okay, thank you. Dr. Taylor, or are you all set?
Yeah, I'm cautious to close down, independent businesses if there's no crowd there. But certainly with the schools, the governor is asking all public and private schools to be closed for 3 weeks. I'm not sure that the students would have access to the schools.
I'm sorry, I missed the last thing you said. The students may not have access to, I'm sorry, what was that?
I think the schools will be closed. I don't think there'll be access for students for outside school activities.
That would be true, yes. Agreed. Cheryl?
So we have a few facilities in Acton that do specialized teaching, like the Russian math and mathnasium are two that I can think of. I'm just looking for some guidance for those activities.
Well, I guess I would revert to previous, is if the schools are closed, then if they're a school-style operation, then that would probably not be a good activity to be continued. Unless they, have a plan where they're going to be able to meet minimum size or maximum size, safe separation, disinfection. I mean, like I said, it's not our goal to punish anyone. It's just to keep the virus from spreading. If they can continue to operate and protect the public health, then that'd be great. All right, well, I'm going to then move to the next subject. We have a lot of different things for which there isn't guidance, and we kind of have to make this up as we go along, try to do the smart thing. Mr. Conaby had mentioned like hair salons and so forth where there's high touch but one-on-one type activities. That's a difficult one for me. I don't really have a good idea. I'd be open to suggestions if anyone would care to share what they would think would be the appropriate way to try to protect people and protect the public health and prevent the spread of the virus. What is the appropriate remedy? Ms. Becerra? Dr. Singh?
It's basically the same. They should be taking all precautions and try to keep the number of people in the salon as minimum as possible so that they are not in close proximity to each other. And that's all we can do at this point, because or otherwise, like, the elderly people should not be going to the salon for 3 weeks. I don't think it'll make a huge difference for them, right?
Okay. Certainly for those of us you know, with visits to the salon are getting further and further apart. But, Ms. Bezzetta?
I would just add,
Hi, Bill.
I've probably received dozens of emails from places I have done business with in the past or may do business with in the future, and I've been assured by all of them that they're putting in all these protocols and so forth. So I guess, you know, to reiterate that, making sure that there are only a certain number of customers in the facility at one time, and you know, an affirmation from them that their employees are told to stay home if they are sick or if somebody in their household is sick. And then also customers, the same thing, if they are sick or a member of their household is sick. You know, the same thing, I have a routine dentist appointment coming up, you know, I would imagine, you know, some of these places, people are, you know, it's super clean, but it's similar, you know, it's elective. It's not to get my hair done, but, you know, it's a similar one-on-one where there's certain protocols to be followed.
The elective procedures can be postponed, right?
Dr. Taylor or Mr. Conomy?
Yeah.
Dr. Taylor?
Yes. The interesting thing, the governor covered that, and the hospitals would be allowing lots of surgeries. And they restricted visits to hospitals. But the land said, I think it's really, no case should be allowed to come in contact with others. So if a person has a common symptom, whether they're a customer or employee, they should just come on.
Okay. Thank you, Dr. Taylor. Mr. Conoby? Are you all set? Or?
I think pretty well said. I agree with Dr. Will about the elective and high-risk population, but it's also important to suggest to the establishment they ask before a lot of contact whether they've had any risk exposure, so they wouldn't, the providers would be a little more guidance would help.
So, Mark, I apologize. We were getting about every other word of that, but I think we got the general idea that we should be following the guidance and making sure that, you know, they're incorporating best practices. And Cheryl?
Yep.
Oh, Mike's joined us? Great.
Hello?
Hello, Mike. This is Bill, if you can hear us. Do you have any comments on suggestions for high-touch personal services like dental hygienist visits or hair salon visits?
I do it. I mean, it's kind of like the same thing as like 25 people. Oh, I think you can use probably Bill after.
I'm sorry, we did not.
Hi, Bill.
I could not understand that. Could you please repeat that?
Yes. So I think with the high-touch establishment, you need to reduce it to the same level as for other gatherings.
Okay.
For example, sorry.
No, thank you. I think we got it this time. Okay, well, along that line then, I'd like to, and I think we have a consensus of opinion. Along that line, I'd like to move on because it's very, very closely related and it would help with some of the people that have come to the meeting. Heather is from the nursing service. You also have a high-touch personal services and with a potentially, I'll say, vulnerable population, and would be interested if you have any guidance or suggestions, anything that we can do or perhaps you can help us with what you're doing, and maybe we can incorporate that somewhere else.
So I was on a phone call today with some guidance for home health agencies, specifically not only for Medicare certified agencies like ourselves, but ASAPs like Minuteman Senior Services, private agencies, anyone under the Medicaid services that have long-term caregivers that are in the home. So the recommendation is really same guidance, obviously hand washing, good hygiene, but calling people before you go in to visit, calling to make sure they're not sick, that someone in their home isn't sick, and doing as much telehealth as you can over the phone, if it's possible. Which there's definitely patients that you can communicate over the phone for specific things that may have family members, but then for those who don't and who are isolated, those are the folks that we really need to reach out to. But the guidance is to make sure the phone calls are happening. So we started that this morning. Any of our clients that are on our schedule for today got a phone call, checking on their status, that they're healthy, no one in the house is sick, and before we went out to the house, not only for their protection, but our staff protection. And then our staff, of course, if anyone is sick, they need to stay home and they won't be doing visits.
Okay, thank you. It occurred to me as you were saying that that's also a technique that could be used by things such as dentist offices or hair salons and so forth, which is a preliminary call.
Oh, sure, absolutely. A lot of the elective surgeries have been being canceled as of today. I know that has been happening with some of our clients that had pending surgeries that were elective that we knew about ahead of time. So that is definitely happening. And there are other recommendations or, businesses with a high touch that are sort of backing down and doing some different things. Dentist offices too. I think the routine things are sort of taking a step back.
Okay, thank you. Are there comments or observations or questions from members of the board? No?
I think those are excellent recommendations.
Okay, thank you, Dr. Bill. Well, Heather, since we'll try to make good use of your time, there's one other thing that the board would like your opinion on. Potentially, we may eventually have some sort of drive-in testing or hopefully someday a drive-in vaccination or a vaccination ability. And I know that the nursing service has actually been a pioneer in the area of drive-in or drive-through testing vaccinations. I know we kind of did some pathfinding for the state in that area. So your recommendations would be very interesting. If there's an opportunity to do drive-in testing or drive-through testing, would you be the organization to support it? And if so, or even if you're not, would you have recommendations that you could share?
Sure. As you said, we have done the drive-through clinics when H1N1 was going on. We started doing the drive-through clinics at the transfer station, and it worked really well. We did it for a number of years, getting everything ironed out to the best of our ability, but of course it wasn't considered a pandemic at the time. My recommendation would be if that is something that we need to do, we continue to do it at the transfer station where we've done it before. I think we'd need obviously more assistance with volunteers from the Medical Reserve Corps, assistance from police for safety reasons or crowd control. I think it would be a much bigger level than we've had, but I definitely think it's something that we should consider when and if that happens, whether it's testing or the immunizations, hopefully someone down the road.
Great, thank you. So you believe you would be prepared to support that if called upon?
Yes, yep.
Excellent. And one recommendation I believe I remember from previous things is that it's helpful to give people a time slot. And you can, I think we even did it by, what street you live on or what area of town you live in or what the first letter of your last name is or some method to try to, limit everyone rushing to come at the same time.
I don't think we did that initially when we were doing the clinics at the transfer station. I think we did that when we tried it at the high school. That was our first location, I believe. I wasn't director then, and I apologize. The problem with the high school was there were too many points of access, so we couldn't control where people were coming from and limit that, do any kind of social distancing, which was a focus also. Whereas the transfer station, folks were in their car, they didn't get out, the nurse went up, talked to everyone, gave the information, gave the vaccine, and people would drive out. We didn't do it specifically at the transfer station with guidelines of, certain parts of town, maybe by precinct or whatever the case may be, but it's a very good idea to get that model in place.
Okay, very good. And can I just ask, just one follow-up? For those that aren't able to drive to come get testing, can you support providing service to them as well?
So we do a number of clinics to the group homes in town, as well as anyone who is isolated at home and homebound. We have nurses that go out to the home and give vaccinations, so that could also happen.
Excellent, thank you. I ask, are there comments, questions, or concerns? And I'll open this to both the selectmen and the members of the Board of Health. Cheryl.
So Dr. Jacoby just informed me that the Dental Association has asked all dental offices to close until April 6th. Just wanted to tell you that.
Okay, thank you. As we said at the beginning, this is a situation that seems to evolve extremely rapidly. By the end of the meeting, there might be something else that we'll learn. Mr. Barry.
I was just going to ask Heather if you have any idea what the status of the availability of test kits are. And I think it's my understanding that one of the big problems is the labs aren't equipped to interpret these tests, and you have to mail them out and bring them back. But can we expect that there'll be testing going on in the near future?
So besides the state lab, there are other testing areas now. I know Leahy Hospital is doing testing. Quest Diagnostics is one of the labs that has been approved by the FDA. There's a couple of others that off the top of my head, I can't recall who they are. But they are doing testing currently, and they have been in the last few days, since sometime last week. The test kits, I've had calls at my office to see if we're doing them. It has to be an approved lab by the FDA, is my understanding right now.
Okay. Again, just anecdotally, I understand they're working very hard to get additional approved labs because they're both as Mr. Barry mentioned, it's a two-pronged problem. First, you need the materials, the kits itself, and then second, you need somebody that can analyze the materials or the results. And, yeah. Any other questions or comments from members of the board, members of the selectmen? Okay. In that case, I think move on. I'd like to just offer at the moment, I think I've exhausted the material I wanted to cover with Heather, and I'd like to be a good steward of her time and ask if you have any comments or things that you'd like to share with us or issues that you'd like us to address or help with.
I think we just need to continue to get the message out to follow the guidelines of social distancing, now the groups of 10 and under. And especially if the schools are closed, we need to make sure that parents are realizing that means that the kids need to stay home, that they don't need to be out in groups, passing this along. That's the reason for social distancing. It's the reason things are closed. I mean, I think that's a huge message that really needs to get out in any way that we can send it out.
So lack of school does not mean form a play group.
Correct.
Yes.
Yeah.
Understand. I'm going to do a little unusual procedure. I'd actually like to offer you, Heather, the opportunity to go home. But before we do that, I'd just ask, are there any members of the public that would have a question for Heather of the nursing service? Ask if there's...
Actually, yes, we do have one question from Franny Osmond. specifically to the service, and it says, is the Acton Nursing Service a source of questions or visits when someone is sick?
Franny, thanks for your question. Right now, the recommendation is for boards of health to do telemonitoring of anyone who is under quarantine per the Department of Public Health. We are taking calls and making recommendations and referrals to physicians and/or the State Department of Public Health, to the epidemiology department, as we are supposed to do. It's outside of our realm as nurses to order labs, to diagnose clients who are calling or who have stopped in. So we are referring them both to their own physician and the State Department of Public Health, and if they don't have a doctor, to the State Department of Public Health, most assuredly.
Thank you. If there are no other questions, I'd like to thank Heather for taking the time to come with us tonight. I think it's tremendous that we have this resource in town at the nursing service. I think this will be a great benefit to the town. So thank you, and if you wish to leave, I think that's fine.
I'll stay for the rest, if you don't mind.
Do not mind at all.
Thank you.
Okay. Very good. In that case, I'd like to move on to a couple sort of administrative things that we can discuss. One would involve the selectmen, which would be other town boards. And I don't want to pick on any particular town board, but we have a great number of them in town. Some of their issues that they address are more pressing than others, and I'd like to suggest that it would be the selectmen's action to advise those boards to either conduct their meetings electronically or postpone them until such time as the crisis has passed. Madam
I
Chairman.
think we'll discuss that tomorrow night at our meeting and take appropriate action.
That would be excellent, thank you. That actually brings me up to something that would also be a selectman action, and it's a little bit premature, but I'm sure it's certainly something you're aware of, which is town meeting. That's hopefully a group of more than 10, if it's but as a consequence, if the guidance is still in effect, it would be difficult to hold it as scheduled. And I'm sure you're looking into that, just if there's anything we can offer.
We will be discussing both the election and the town meeting tomorrow night.
Excellent, thank you. Okay, so moving along, this is where I'm sort of addressing this in order of, I'll say, criticality, at least in my mind, criticality. We have a few other items. I mentioned grocery stores before. I'd ask a recommendation for members of the board to endorse that the health department suggests that the grocery stores do things to limit practices that might cause sharing of the virus, such as salad bars, self-serve food, anything along those lines where you could potentially have contamination from one person to another, and that those activities should probably be terminated until the emergency is over. Ask for comments from members of the board.
I agree. Absolutely.
I completely agree with you, because that would be one way of transmitting the infection.
Dr. Taylor?
Yes, we need grocery stores.
Yes, I'm a big fan of groceries myself. So, Mr. Conaby?
Yes, I had sent those information to Cheryl earlier. I think, as you said, salad bars, buffet, self-service, and then obviously a lot of the other items like closing up breads, if we can do some of the vegetables or other things, try to provide things that are contained. And then going back to your comment about like paper bags, and then making sure anyone would use a reusable bag that would be washed before and after, so it doesn't become a vector in transmission means. So obviously best practices, but also best precautions, and try to work with our suppliers and folks in the community to have a better situation.
Thank you. Mr. Cruz? Dr. Jacoby? Well, I apologize to either of you. If you can hear us, we unfortunately cannot hear you. And I'll just amplify a little bit of what Mr. Conaby said. He's referring to, I believe, a study that was done in California University recently where they used a biomarker, but it had to do with the reusable shopping bags, and they found that if they came from a house where there was someone that was potentially, I'm sorry, they used a marker. They didn't use an actual live virus, but the results suggested that if it came from a household that had a virus, using a reusable shopping bag could potentially spread the virus because things, particularly the conveyor belt at the checkout line, the touch terminal for putting in your credit card, the cashier's hands for picking up items, became contaminated using this marker. So a suggestion would be that we try to put out the word to make sure that anyone that wishes to use a reusable bag, wash it before and after going to the store, or use disposable bags such as paper bags that are available at the supermarkets. It's something to point out. It's something you might not think of as being a source for spreading the contamination, which we don't want to do. Okay, I'm moving down the list. I think we've covered a fair amount of what hopefully we wanted to be able to discuss. At this point, I guess what I would ask is if the health department or the nursing service has any new information or any topics that they feel would be appropriate, they need board guidance or input on. Okay, hearing none, we'll move forward. I think we've covered as to whether or not there's any, we've covered the new updates from CDC. I believe we've reached the end of the topics that we had planned for discussion. So at this point, I'm going to ask if members of the board have any other topics that they wish to bring up or discuss. I'm just going to go around starting to my right, so that'd be Ms. Becerra.
I have no other topics.
Dr. Singh?
I would just like to say that everyone needs to take it seriously because some people are not taking it as seriously as it should be taken. So again, take all the precautions and be safe.
Thank you. Dr. Taylor?
I'm wondering if everyone in Athens wear the mask.gov website and the cdc.gov website. I think there's still misinformation or people are
I apologize, Dr. Taylor. We're not quite able to understand you. Could you either speak a little louder or move closer to your microphone?
So I was just wondering about messaging. Does the town feel they can take a role in that, or are they satisfied that people are doing that on their own?
Did anyone understand that? Mr. McJay?
I believe he's asking about messaging and what support the town can provide in pushing out messages from the Board of Health, I believe.
Okay, are you talking about like reverse 911, Dr. Bill?
No, just messengers.
So like on the website and so forth?
Yes.
Okay. Well, that would be a question for you.
Thank you. So, John Mangiarotti, the town manager. We've been meeting daily with staff and public health officials locally and within the community, and we've been doing our best to publish information on the website almost every day, and we intend to continue doing that. So any information from the Board of Health would be great content for right at the top of the messaging. So we look forward to that.
Great, thank you. Mr. Conaby, any other?
I guess just a little update on the town preparedness, dealing with the issues that first responders are having. We're hearing about supplies, the personal protective equipment, and then just more planning and more updated information and how we're going to be going forward would be helpful.
Okay. Cheryl, do you have anything to add or for a future meeting?
We have had discussions, John's called large meetings where, well, and we have to do under 10 now, but we've had meetings where we've discussed that, and I don't know if John can speak to, you know, what fire or police may be having issues with. I'm not certain.
Yeah, Mr. Conaby asked in particular, I believe, about personal protective equipment and whether there's an adequate supply for.
I'm not aware of that answer, but I'm thinking that there's been an issue. We do receive updates from the state with calls out for towns looking for additional equipment, and everybody's kind of grasping to try to find it. I don't know what our levels of supply are, though.
Okay, well, that's something we'll continue to look at. I apologize, before we were having difficulty, but either Mr. Cruz or Dr. Jacoby, do you have any subject or questions that you wish to add? Again, I apologize. If you're on the line, we can't hear you, so I'm going to keep moving forward. In that case, what I would like to do next is ask if members of the Selectmen have any questions for the board or comments or.
Yes, I think, John Benson, you have questions for the...
No, I don't. I just really want to thank you. It would be very impressive, and and we're very fortunate to have all of you. And I think this is going to be a real long haul, and it's going to really test the resilience of all members of our community. And the social distancing is so crucial, and it's going to be I just see it in our neighborhood where the young kids go on play dates, adolescent boys and girls go out and play basketball and other games, with their neighbors, and it's going to be a real test.
Agreed.
Nothing for me.
Thank you very much. I think this has been very helpful.
Thank you, ma'am. I did intend to continue just with questions for members of the public, if you wish. But. So at this point, do we have questions for members of the public?
There are two verbal questions. I'll unmute the first one. Can you hear us?
Thank you, Tara Frederick. Yes, I can. Thank you.
Yes, please go ahead.
Tara Frederick from West Acton. Yes, there's been a concern because their stores are out of toilet paper, alcohol, thermometers. And I have a second question about medical beds and my experience in disaster response management is that once the hospitals fill up, they fill up very quickly. And I'd like to know what the plan is to convert the high school or wherever to a hospital ward And how many beds or cots do we have? And thank you. I can take the answer offline. Thank you.
Thank you, ma'am. I'm not sure it came through completely as to what your question was, but I think I got the sense. So I'll answer the question I think I heard you ask, and you can tell me if it wasn't correct. I think you said that there's a lack of supplies available in the community at the stores, such as hand sanitizers, masks, thermometers. I'm sorry?
Toilet paper.
Toilet paper, yes. Unfortunately, I'm just going to have to say that's something that this board doesn't control. I read a news article yesterday that Walmart said they've ordered more goods to be brought into their store than they typically order for Christmas. So the retailers acknowledge that it's an issue. Say they're working their supply chains to try to resolve it, but we have no particular influence to be able to solve that problem, I'm afraid.
Well, I guess my question is that the town and the schools have cases of toilet paper someplace, I'll bet. And wondering if we can get that.
Well, I would say that's not particularly what our board typically addresses, but I'll ask the selectmen.
Thank you. I can leave that. I don't need the answer now. I guess I just wanted to register the concern. My question for the Board of Health is about hospital overflow and the setting of cots and the signing up of local volunteer doctors.
Okay, so you're addressing a concern which is obviously front and center on everybody's mind, which is the entire point of the social distancing that's going on right now, is we need to slow down and hopefully eliminate the spread of the virus so that the overload at the hospitals and healthcare providers doesn't happen. If we're unsuccessful, that's the worst case, where there aren't enough beds, there aren't enough ICU beds, there aren't enough ventilators. It just doesn't look good. So we need to stop that. That is what the focus of our activity is. If that unfortunate, that worst case scenario comes to pass, I'm sure there will be guidance from other organizations. I can offer that is something that we have considered in terms of how we would establish additional beds. We did disaster planning for the flu many years ago, and it included things about how we would establish additional resources for overflow need. And I'm being slightly vague in my comments because I don't want to predict what we would do because I just don't know. It would really depend on what the circumstances are, and that would be everything from the weather to the number of people that were sick to what the available resources are. But
Thank you very much.
Okay. I just address I'm sorry, there was a last point had to do with the Medical Reserve Corps. We do have a Medical Reserve Corps in Acton. If you're a medical professional, please contact Cheryl. She'd be happy to add you to the Medical Reserve Corps if you're not already part of it. Is there another question?
We do have one more from John Peterson.
Mr. Peterson, please go ahead. I apologize. I'm afraid our link is not working. If you can hear us, we can't hear you.
Can you hear me now?
We can hear you now.
Sorry about that. Thank you for all the work that you've done to respond aggressively to the disease while we've been in a position where there has been very limited testing available. I'd like the board to consider that the actions that we take should be broken into 3 phases. The first phase related to the period of time before we have adequate testing, which is probably the next 2 to 3 weeks. The second phase is after we have adequate testing so that testing can be part of the ongoing response to the incidence of the virus. And I think it's important that as the board looks forward, if we look at data from South Korea, there is evidence that there will be an ongoing low-level infection that we will need to respond to. And since that period of time is more likely to be months than weeks, I think we'll need to revisit, all of our strategies around social distancing. Thank you.
Thank you, Mr. Peterson. I agree. I mean, I think this unfortunately will evolve, and we'll have to adapt as it evolves. And I agree, we can certainly learn lessons from the people that have faced this problem before we have. One I just had previously learned in conversation was some lesson learned that it's not for this board, but South Korea used the tracking data from cell phones, and for people that were infected with, or shown to be infected with COVID-19, they published anonymously the map of their locations for the previous few days. And this had a benefit that it could allow the citizens to view the map, and they could tell, first of all, if they were likely to have come in contact with this person or not likely to have come in contact with the person. So that helped them have a little better, handle on managing their own situation. I'm not suggesting, certainly that's something the Board of Health wouldn't address, but there are many other lessons like those that we can learn from the folks that have faced this before us. So if there are no more questions, then I'm going to suggest that this meeting is probably at its conclusion. If there are no other comments from members of the board, this would probably be appropriate time to adjourn.
So moved.
Second.
Very good. We have a motion made and seconded to adjourn. All those in favor of adjournment, please say aye.
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 Aye. 3 ayes. Mr. Conaby, Dr. Taylor?
Aye.
Dr. Taylor? Very good. We have 5 ayes. Maybe 6. Meeting is adjourned. Thank you very much.
Thank you.
Goodbye.